Helen Keller once said, "Alone we can do so little, together we can do so much." And that's become almost the de facto mantra for organizations working together. Nonprofits, government agencies, and socially responsible businesses form networks where they maintain their autonomy but find creative ways to work together in order to make a social impact. But is that Helen Keller's statement actually true for these networks? Do networks make a bigger social impact than the organizations in them would have done alone? And if so, how? Well, the good news is that yes, many networks do in fact make a bigger social impact than the individual organizations working alone. In my co-authored book, Networks for Social Impact, we talk about dozens of these networks. Networks like Age Well Pittsburgh, who's made a difference for seniors living in their area, or America Serves, who make sure that veterans find the services that they need, or the Multi-Agency Alliance for Children in Atlanta, who serves Georgia foster families and children who are in the foster system, helping them have better outcomes than they would see otherwise. In short, yes, networks can make a bigger social impact than individual organizations can alone. But in my experience, many networks don't make that social impact. They fall short of the promise of creating a bigger social good than the organizations within them would have done alone. And the reason why is they often don't consider their theory of change. The theory of change is how networks working together are going to connect their activities to social impact. It's about the translation of all of those meetings and all of that work into some type of social good for a community. There are 5 theories of change that are common to networks who make a social impact: project, learning, policy, catalyst, and systems alignment. Project-based theories of change are based on a creation of a new program and services as a result of the joint efforts of the organizations in the network. The social impact that that network makes depends on the quality of the program. For example, consider Ready, Set, Parent. Ready, Set, Parent was a program in Buffalo, New York, formed through Catholic Health, Epic, and Baker Victory Services. Those organizations came together to form a new program for parents in hospital. That program gave them a toy, some diapers, some basic things that they needed, and most importantly, training about how to form an attachment with a new baby. The social impact of that program depends on how good the program was. How good was that training? Did it in fact change the attachment that parents had with kids? Learning-based theories of change, in contrast, don't ask organizations to create a new program and service. Instead, it asks organizations to come together to think about their current programs and services and make them better. These theories of change often require organizations to investigate evidence-based practices from research or benchmark their performance against other organizations in the network. Coalitions That Care are a great example. Coalitions That Care is an evidence-based program that tries to reduce risky youth behavior, including substance abuse. The organizations in the network learn key insights from prevention science that help them to improve existing programs and services. And in doing so, they make their programs and services better for their clients and create a social impact. Policy-based theories of change, in contrast, rely on the organizations in the network getting concessions from governments in order to change regulatory policy or legislation. The social impact of these networks depend upon whether or not they are successful in their advocacy efforts. When organizations work together in policy networks, they depend upon their collective action or their joint voice being greater than the voice of the individual organizations alone. Consider, for example, the Dutch Climate Accord process. This interesting process in the Netherlands required hundreds of organizations to come together in order to create a policy recommendation around climate change. The social impact of that process depended on whether the Dutch government, adopted that those climate change recommendations. Catalyst-based social impact and this theory of change depends upon the principle of diffusion. Networks who are using a catalyst-based theory of change have a great project, a great program, a great set of principles, a great technology. And their social impact depends on getting more organizations in their network to adopt it. Think, for example, of the Graduate Network. This Graduate Network is a wonderful program that was started in Philadelphia, Pennsylvania. And it was designed to help individuals who began their post-secondary education but then stopped actually complete their degree. The Graduate Network takes some of the principles that they learned in Philadelphia and applies it to organizations in cities across the country. And the success of their network depends on getting more cities to adopt their graduate model. Through their efforts, 80,000 comebackers have already completed their degrees. It's an amazing social impact, but it depends upon the diffusion of a model. Finally, systems alignment is perhaps the most complicated theory of change to pull off for networks. It requires organizations to coordinate their efforts so that the whole is more than the sum of the parts. And in doing so, they might identify service gaps where no organization is serving a particular need or a particular population. It's really about aligning those existing programs and services so that organizations do more together. Consider, for example, Summit Education Initiative in Akron, Ohio. Summit is a collective impact network, meaning that it adopted a very particular model of bringing organizations together in order to improve career outcomes for youth. They began by bringing together organizations from across different sectors, youth serving organizations, human service organizations, healthcare, school districts, and they began to align the programs and services coming from all of those organizations. For example, one of the ways that they've really focused on helping organizations align is in the early childhood space. They worked with the existing preschool programs around their city, and they helped them to develop standards that they could use to evaluate how their program was meeting the needs of their students. Those same standards aligned with the public school districts in their area, and through their efforts, they were able to increase the number of children who are ready for kindergarten coming out of those programs. Organizations, the preschools in the program were able to receive training for cohorts of teachers, and they were able to give parents a transition package to help them become engaged in this public school system in the way that they had been engaged in their preschool. It was all about creating a seamless transition across organizations. That's alignment. So one of the questions that I've gotten since I've been talking about theories of change is, do I just have to pick one? The answer is no. You can, in fact, enact more than one theory of change in a network. But these theories of change aren't easy to pull off. And the more theories of change you try to enact, the more complicated this is going to get. I have two takeaways for social impact leaders who want to make a bigger difference through networks. The first one is determine your theory of change. Figure out which one of the 5 you're going to do and go after it. Figure out how you can double down and triple down on your efforts in that theory of change alone, rather than spinning your wheels, launching new programs when it may not in fact align with your theory of how you're going to make a social impact. Second, I encourage social impact leaders to communicate that theory of change, over communicate it. One of the things that I've heard from social impact networks who don't have a theory of change is they seem to reinvent themselves every few years. And they constantly get that nagging question from members. Why does this network exist in the first place? Your theory of change is going to help you stop reinventing yourself and is going to make it clear to each member of your network why they're there. What's the value add of the network above what organizations can do alone? And together, member organizations can rally resources that the network or individual organizations couldn't. That's how networks make a social impact.